Let's talk about why you should be skeptical of EMDR therapy. When I first heard about EMDR therapy, I was totally skeptical. So I totally get this perspective. I thought that it was hocus pocus. It seemed way too good to be true. And it's actually not a bad way to approach EMDR, is with a little bit of skepticism. Obviously, you have to be open enough to try it. But when you're skeptical of any kind of thing going in, there's a little part of you that's observing, is this working? And that's an important piece, right? We should be looking at what's working, especially with EMDR therapy, because so much of what is happening and what your therapist directs you to do is based off of whatever it is that you're observing. Now, you shouldn't be so much that you can't be into it, but a little skepticism doesn't hurt. The way that I just kind of moved through some of those skepticism is that I went to a peer consultation group, and we were kind of taking turns in finding out about EMDR and other modalities. And there was a therapist that had been trained in EMDR, so she came in and did a little demo and asked for a volunteer. And so with all of my skepticism, I also had openness. I was like, why not? So I raised my hand as the volunteer, and I had been struggling. I had a client that at this point I was doing a lot of trauma-focused CBT with my PTSD clients, and I'd had a client who had had severe trauma, like tons and tons and tons and tons of trauma, and she actually had a really great response to trauma-focused CBT. She'd gotten all the way to treatment complete. She was doing great. She's going on to live her life and doing great things, going back to school, all kinds of stuff. And this was like 2 to 3 months afterwards. And I was, I was still having like thoughts about her story pop into my mind. So some intrusive thoughts. I would wake up and I would be thinking about her. So this, in the therapy world, we call secondary trauma. So you can actually get PTSD symptoms from hearing about someone else's story. So it's not just going through it yourself. If someone that you feel attached to or care about in some way was hurt and you hear this story, it can kind of get seared in your psyche and get stuck, just like going through it. So that was happening to me a little bit. And I put my hand up for this demo, and I didn't think anything was going to happen. And I'm telling you, in 20 minutes, I had cried in front of the whole group of therapists, which I'm not a very public crier, and had really processed it through. I felt so much better. And to this day, when I think about that client, first of all, the intrusive thoughts stopped. I stopped thinking about her in the middle of the night. And when I do think about her, I think about her fondly, and I know that she's doing well. And I'm super excited for her and for her life. And so that's just a little bit of the power of EMDR. So when you go in with a little bit of skepticism, balanced with a little bit of openness, EMDR therapy can still be super, super helpful for you, and just a really great way to move through things that feel stuck. Hope that's helpful. And if anybody out there is looking for some EMDR therapists, we do have a few openings. So come on and see us at Hope for the Journey, and we'll get you all set up and started feeling better so that you can really be thriving in your life. That's our goal. Thanks.